All right, welcome to another episode of ICU Doc Talk. Today we're going to talk about blood pressure, and I'm going to talk about it broadly and then become more specific. I'm going to start basic and then get more specific and advanced with my discussion. I'm going to discuss a little bit of outpatient blood pressure. I'm going to talk about what is blood pressure, what is low blood pressure, what is high blood pressure, what is the significance in different settings. I'm not going to talk a lot about outpatient high blood pressure because it's not my field, right? I'm not a family medicine doctor or an internal medicine physician doctor. So I'm not going to really touch on that a whole lot. But let's get into it. Here. Okay, first up, we're going to talk about some equations. Like, let's define what blood pressure is. And I'm not going to spend a whole lot of time on the math, but if you would like to, you can kind of draw out what I'm talking about, the math. It's not, it's just basic algebra. But if not, if you're just like listening to this on your commute, you don't need to worry about this too much. I'm not going to spend too much time on this, but understanding that the equations, how the math works, is actually very important to understanding the physiology, like the actual clinical physiology. It is important. It's not nothing. It's not just theory, right? It actually has an impact on clinical practice, understanding the math. So what is blood pressure? Well, just boiling it down conceptually, your heart is a pump. It's an organ, right? Just like, you have lots of different organs, but the organs of your body have many different functions. And the heart is very unique. It's a pump. It's a muscle. It doesn't really secrete a whole lot of like hormones. It does. And I'm sure there's an endocrinologist who could explain to you that there is actually, hormonal regulation that goes on with the heart, maybe. But, as opposed to like the adrenal glands and the kidneys and even the lungs and the liver, it doesn't really secrete a whole lot of stuff that your body is physiologically dependent on. Again, it does to a nuanced degree that is out of my wheelhouse. It's a pump. It's a muscle, and it pumps blood. It generates, and it is what generates your blood pressure, obviously, right? It helps to generate your blood pressure. Now, it's not the only thing that generates your blood pressure, right? So it's a pump, and I'm going to get into the math in a second. It's a pump, but you also need, what also generates your blood pressure is the resistance of your arteries and your veins, of the entire pipe. Just think of it like pumps and pipes. You can't have blood pressure unless you have pipes as well. So those pipes also maintain the blood pressure. They pressure. It's a pressurized system, right? It has blood in it and it's pressurized. And obviously you need this pressurized system to deliver blood and nutrients to your tissue beds. Okay? Just keep it really simple. So your heart generates blood pressure, so do your blood vessels, which I'm going to get into how the math applies to this. So what is systolic blood pressure? And again, starting basic, but I will build from the basics. There's systolic and diastolic blood pressure, right? I'm sure you've heard about that. Maybe you've paid attention. Maybe you're in medicine, maybe you're not, and you've never really paid attention. What is the difference? It's really simple. So your blood pressure, while your heart pumps and it relaxes, okay? It doesn't just pump and pump and pump. It pumps and then it relaxes. Pumps, relaxes, over and over again. Of course, it needs to relax to refill with blood, of course. And so systole is when the heart is pumping. Diastole is when the heart is relaxing. That's it. It's really simple. Systole, pumping or contraction. Diastole is relaxation or filling of the heart. So during systolic blood pressure, your heart is ejecting, so your systolic blood pressure is always higher than your diastolic because it's during forceful contraction of your heart that's shooting into your aorta and the rest of your arteries, right? So that's the systolic blood pressure. The diastolic blood pressure is when the heart relaxes. That's the blood pressure when the system is more relaxed. Now, is the system still pressurized during this time? Of course it is. If it didn't have any pressure, that would be bad. You would faint, right? Your organs would, your brain would suddenly not get any blood pressure. How does the system stay pressurized during diastole, right? If your heart is pumping and is delivering pressure to your system and then it relaxes, well, the heart muscle has to have very, very low pressure to fill. So doesn't the rest of the tubes of your system also get that very, very low pressure? The answer is no. So how is diastolic pressure maintained? By a valve, right? Again, very basic stuff. It's by a valve, the aortic valve. The aortic valve opens up during systole as the heart contracts. It lets all the blood through. And then as the heart releases, a pressure gradient turns it around and the aortic valve closes. And that closure of the aortic valve provides a diastolic pressure. The diastolic pressure is still lower than systolic pressure, but it's still there, right? The typical is like 120 millimeters of mercury over 80 millimeters of mercury, systolic over diastolic. So a typical person, 80 millimeters of mercury during diastole, your body is still pressurized, but your heart is not even pumping. And it's all because of your aortic valve providing that back pressure. So the pressure doesn't just release back into the heart while it's relaxing. Does that make sense? So when you think of blood pressure defined as there's a systolic blood pressure when the heart is ejecting, there's a diastolic pressure when the heart is relaxing and the aortic valve is closed. So that's one cardiac cycle, right? One cardiac cycle is when the heart pumps and then relax. That's one cardiac cycle. So there's a systolic pressure, there's diastolic pressure, but what is the average pressure that your body is experiencing over that one cardiac cycle? And we call that the mean arterial pressure, or a MAP, M-A-P, mean arterial pressure. That's more of a meaningful number, a meaningful value of how well your body is being perfused. What is the average pressure that it's seeing, right? Because it's not like if you have a systolic of 120, your organs are they're not experiencing a pressure of 120 that entire cardiac cycle. It's all about averaging it out. And that's why the mean arterial pressure, or the MAP, is, to me, is a more, depending on the clinical context, is a more meaningful number about when I'm considering, hey, how well is this patient's organs, how well are their tissues being perfused? Because if someone has a systolic pressure of, only like 90, not 120, but they have a diastolic pressure that's a high of, say, it's 75, maybe their mean arterial pressure is okay. In the mean arterial pressure, the way you figure it out is it's simply it's 2/3 of the diastolic pressure plus 1/3 of the systolic pressure. So let me repeat that. The mean arterial pressure, the MAP, is 2/3 of the diastolic pressure plus 1/3 of your systolic pressure. So the mean arterial pressure, most of what makes up your perfusion of your body is the diastolic pressure. It's 2/3 of the mean arterial pressure, whereas systolic is only 1/3, meaning you spend more time in your diastolic and diastole. And a high diastolic number could give you more mean arterial pressure if your systolic pressure is low, if that makes sense. So whether I'm in the operating room or in the ICU, and I'm wondering, hey, what is this patient's perfusion? Are they perfusing their body? How well? It's always a question we kind of ask ourselves. Well, if their MAP is 80 or 75 or 70, usually targeting MAP is what I care about more when I'm talking about perfusing their tissues. Now, there's other blood pressure parameters you might care about. You might care about the systolic pressure more. Say someone has a type A aortic dissection, which is, you might want to keep your systolic a little lower, because if you have a high systolic, you might have more shear forces on that aortic flap that could extend that dissection flap up into the carotids and down below into the iliacs or whatever. So my point is, it might depend on your situation more, what your parameters are, right? What you want to keep your blood pressure at. But a MAP of 65 or 70 is plenty to perfuse most healthy people. But that brings up another point. There's something called auto recalibration, right shift recalibration. Let me talk about that for a minute. I'm going to shift into high blood pressure. So let's talk about people walking around the community that are walking around with high blood pressure. Okay, it is one of the most dangerous things you can do to your body over the long term, right? Not short term. We're not talking about short term crises. Over the long term, someone walking around with too high blood pressure is one of the most dangerous things you can do to your long term health. It's extremely dangerous. It puts you at risk for stroke and for heart disease and atrial fibrillation, arrhythmias, and things like that. One of the most important things someone can do to ensure that they try to live longer is to control their blood pressure. These very fundamental basic things, if people do them, they may extend your life. If you're walking around with a blood pressure of 150 over 100 over 10 years, 20 years, that's going to cause problems to your body. That's way too hard on your heart to that's too much afterload on your heart, and that's too much blood pressure for your blood vessels. It's too much blood pressure for your kidneys, for your brain. It can cause, and then it puts you it weakens your blood vessels. It can cause hemorrhagic stroke, and then you can definitely have kidney disease from that and heart disease. So it's one of the worst things you can do to your body is just have uncontrolled blood pressure. So whether that's losing weight, and yes, gaining weight is a risk factor for high blood pressure. Losing weight can help people drop their blood pressure. Losing weight is obviously easier said than done. And if that's not something that is difficult for you to do, to lose weight, which is very hard for many, many people, even though it's not just a calorie in, calorie out thing, right? Sometimes you just can't, despite everything you're doing. Then you need to be on a blood pressure medication. You got to get your blood pressure down. Seriously. It'll kill you. It'll very likely kill you if you don't get your blood pressure controlled. But my point, talking about high blood pressure, is, okay, now let's say someone comes into the operating room or the emergency department or whatever with a blood pressure. They've been walking around for 10 years with a blood pressure of 160 over 100. So why don't we together, let's calculate that map, the mean arterial pressure, right? So I'm going to bring up a calculator here. Remember, what is the equation for mean arterial pressure? 2/3 of the diastolic plus 1/3 of the systolic. Okay, so we're doing 160 over 100. So 2/3 times 100, right? That's the diastolic. That's 66.6. And then 1/3, I'm doing a calculator myself, times 160. That's 53. So 53 plus 66. So they have a map of 119. Did I calculate that right? Yeah, I guess so. That's really high. That's a high map. Okay. Now, here's why this is important. Their brain is now, and their tissues, there's something called it's called cerebral autoregulation. Okay. What this is if say your blood pressure goes low, the blood vessels of your head will constrict to continually supply a good blood pressure to your brain, right? Remember what I said before, your blood pressure also depends on your blood vessels, not just your heart. So this is really important mechanism, this cerebral autoregulation. So you don't faint. Say I don't know, your blood pressure is low for whatever reason, your brain will constrict its blood vessels to provide a consistent flow to your brain. With people with high blood pressure, that autoregulation system gets shifted to the right on the graph. If you care, you can go look it up. This is my main point. These people now need a higher mean arterial pressure to ensure good cerebral autoregulation and probably renal autoregulation as well. So my point is, people that have chronically high blood pressure, you need to provide higher maps to them in the operating room, right? So your map goals should change depending on the patient. If they have if they should have a map of 85 at least, a person like this, or higher if you can, if they're really right shifted. Another thing that a lot of people fail to understand about people with chronic hypertension is when they come into the operating room, let's say you get this person, 160 over 100, that's their blood pressure. They've been walking around for 10 years like that. They're oftentimes hypovolemic. Let me repeat that. People with chronic hypertension, chronic high blood pressure, are oftentimes hypovolemic. They have lower circulating blood volume. And I know that sounds paradoxical, but it's not. Just think about it for a minute. If someone's blood vessels are all tightened up and they're squeezing harder, their actual volume of blood that's circulating is less. There's actually less volume that's occupying. So if you induce someone with anesthesia, or anesthetics often cause low blood pressure, right? You do that. You drop their blood pressure. You're dropping their systemic vascular resistance, which I'm going to get into in a second, and they're hypovolemic as well. And now their blood pressure is in the gutter. They're profoundly hypotensive, and you need to give them volume as well. So just because you're hypertensive doesn't mean you're hypervolemic. That's a very important point. Okay, now let's get a little more nuanced with the math here. Okay, this is the only other math that I want to talk about, but it's so important. And it's so important that if you're a practitioner that you understand these things really, really intuitively. It's extremely important. Okay, so if you're interested, go look up Ohm's law. Okay, because the laws of the blood pressure of your body that your body uses also obey Ohm's law. Okay, Ohm's law is V equals IR, where V equals voltage, I equals current, R is resistance. So voltage is equals the current times the resistance. I won't spend too much time on this. You can gloss over this if you don't care. It's fine. Voltage is a gradient of basically a what's the right way to say it? Voltage is like it's the pressure gradient. It's the gradient of electricity. That's what voltage is. So it's a gradient. Current is obviously the current of the electricity, and R is the resistance of the system. Okay, so let's translate this to the human body. Mean arterial pressure, MAP, minus your CVP is the same thing as voltage. It's the pressure gradient over the entire system. The MAP minus the CVP. That's the lowest pressure in your body, right? Central venous pressure. It's usually like 5 or 10. And your MAP is usually, let's say it's 80. So that's, for Ohm's law, you substitute MAP minus CVP for voltage. Equals the current. The current is cardiac output, or CO. Resistance is systemic vascular resistance, SVR. Okay? And so it's a direct translation of that. All right? So, and then cardiac output equals heart rate times your stroke volume. How fast your heart rate is going, and how much volume comes out of your heart with every contraction of your heart. Okay, and then times your SVR. I'm not going to get too bogged down to this. Let's boil it down to the basics. Your blood pressure. What is blood pressure in simple terms? It's a couple components. Just like I mentioned earlier. I mentioned the concepts. Now we're just getting to the equations. Your blood pressure is composed of how fast your heart is beating, how much blood your heart is pushing out, and how much resistance that blood has going through the blood vessels. That's it. Okay? Heart rate, stroke volume, systemic vascular resistance. So the reason this is so important is, doesn't that just tell you right away there are many reasons why someone can be either hypotensive or hypertensive. It's not just one thing. So, hey, this patient has a low blood pressure. Right? If someone says, hey, this patient's low blood pressure, what should we do? My response would be, I don't know. I need to know more about why this patient has low blood pressure. What's their heart rate? Oh, they're in, heart block. And they have a ventricular escape rhythm of 30. Oh, well, that's why their blood pressure is low. And they're about to go into cardiac arrest. Right? Or someone comes up to me and says, hey, this patient has low blood pressure. Okay, well, what is their ejection fraction of their heart? Oh, they only eject 10% stroke volume, right, of blood out of their heart with every. Oh, okay, they have a congestive heart failure exacerbation, and that's where their blood pressure is low. Okay, or hey, this patient's low blood pressure. Oh, well, they're growing gram-negative rods in their bloodstream, meaning they're bacteremic. They have bacteria growing in their bloodstream. When that happens, you have a dysregulated inflammatory response, and you're vasodilated, meaning your systemic vascular resistance, the resistance of your system, is super low, and that's why their blood pressure is low. So many reasons why someone's blood pressure is low, and because of that, there's many reasons, there's many ways, there's these different variables to raise someone's blood pressure. You can raise their heart rate to raise their blood pressure. Right? I work in the cardio surgical ICU. One of the ways I will use to raise someone's blood pressure, oftentimes these patients come with temporary epicardial wires on their heart to pace them. So say someone's on a bunch of epinephrine and norepinephrine. I'm giving them inotropy, contractility, to increase their stroke volume. I've given them fluid to increase their preload, which will increase their stroke volume as well. The norepinephrine is raising their systemic vascular resistance, or SVR. Well, hey, let's pace them at 90, or let's pace them at 100. And sometimes that will help their cardiac output, and that'll help their MAPs, and that'll help their blood pressure, right? Lots of different tools you can use. Okay, so just to review, so the different variables that consist of someone's blood pressure are heart rate. Let's just review the equation. MAP, mean arterial pressure, equals heart rate times stroke volume times SVR. This is also Ohm's law, Ohm's law. So the variables you can use to manipulate someone's blood pressure or to raise it. is you can raise their heart rate. You can either pace them or you can give them something like glycopyrrolate or atropine, depending on the situation. All depends on the clinical context. You can increase their stroke volume by giving them by enhancing their preload, by giving them fluid. You can increase their contractility by giving them an inotrope like norepinephrine or epinephrine or dobutamine or dopamine or isoprotenolol. And then you can raise their SVR, the systemic vascular resistance, by giving, again, something like epinephrine or norepinephrine, vasoconstrictors that get on the alpha receptors, or something like phenylephrine that increase SVR. Okay, that's just, or vasopressin or angiotensin 2, right? So we have a lot of tools, but now this stuff is simple, right? Once you do, I can talk these things off the top of my head because I do this literally every day. And when you get to that level, this stuff, it's basic, it's simple, but the clinical context is extremely important. You need to understand when to apply these things. What is their cardiac input? What is their cardiac output? What kind of data do you have? What kind of patient population is it? It really depends on what kind of patient you have, right? You have a patient who came into the emergency department, they're in hemorrhagic shock, right? And they're bleeding out. Well, you give them blood, right? Or you have a patient who's in cardiogenic shock because they had a heart attack and their heart is barely pumping, right? A lot of different things. Maybe that patient needs some revascularization or a stent or something like that. So what is shock then? Right? What is shock? Well, there's two different types of shock. There's compensated shock and there's decompensated shock. Shock is when your tissues are not getting enough, they're not being perfused enough, and they go into anaerobic metabolism. That's shock in its most basic form. That's what shock is. They're not getting enough oxygen, hemoglobin delivery, and they're getting pushed into anaerobic metabolism. They're producing too much lactate. So lactate is a good marker if someone's in shock. There's different types of shock, right? That's kind of outside of this discussion. I'm sure I've done a podcast about shock. I undoubtedly have. I don't remember. But so shock is someone's tissue beds are not getting enough oxygen or blood flow. Same thing, right? So there's compensated shock, meaning the body is compensating for it, or trying to, meaning the body has increased its SVR, systemic vascular resistance, or it has increased its heart rate. That's why one of the signs of sepsis, septic shock, is an increased heart rate, because the body's trying to compensate. Say bacteria is growing in the bloodstream and it's causing vasodilatory shock. Your SVR is low in vasodilatory shock, in septic shock. Your SVR is, by definition, it is low. Your SVR, right, is regular SVR right now is like 1,000. Like mine is probably like 1,000 dynes per centimeter to the fifth. That's what we put SVR in. That's the unit of SVR. If you don't know what I'm talking about, don't worry about it. But someone's SVR in septic shock is low, and the heart rate is increased to compensate for it. And that may be, remember, the equation, heart rate is a component of mean arterial pressure. So if your heart rate is high, it may be compensating. That's why it's called compensatory or compensated shock. But your blood pressure is still normal, right? So you can be in shock and have a normal blood pressure because it's compensated. When is it decompensated? When the patient decompensates, meaning these compensatory mechanisms now fail and their blood pressure drops. And now they're in decompensated shock. And just to review, there's 4 different types of shock. There's vasodilatory shock. That is always septic shock, where your SVR is too low. There's hemorrhagic shock or hypovolemic shock. That's where your circulating blood volume is too low because you're bleeding out. That's a pretty easy one, not easy one to fix, straightforward to fix. You give them blood and fluid. There's obstructive shock. There's something obstructing the flow of blood. It's usually something like a pulmonary embolism or a cardiac tamponade that's obstructing the flow. And then there's cardiogenic shock, where the heart is no longer pumping. And the cardiogenic shock is unique because the SVR, also an obstructive shock, the SVR is high and your cardiac index or your cardiac output is low. So there's different characteristics of the type of shock. What I'm talking about is extremely important to critical care. And as an intensivist, you know these things intuitively off the top of your head. And you learn them, right? Whether you're a med student or whatever, this stuff becomes really second nature. But it is important to understand these basic concepts. The fundamentals are so important because so one of my jobs is to correct someone's shock and to do it promptly before they go into cardiac arrest and get them out of it, right? You want to recognize these things right away. What kind of shock are they in? How to correct them? What are the diagnostic tools that we can use to correct their shock? It's just incredibly important. Okay, I hope that discussion was helpful and fun. I probably could talk more about it, but I'm getting run out of steam. I'm gonna move to a question someone asked. This is an email from someone named Jenna, whose last name is withheld. They say, I love your content, love to listen to it, and want to be an ICU nurse. It's awesome. I love ICU nurses. They're incredible. Anyway, this person saying, we had a late teenage boy come in by ambulance from their dentist office. This is where she works. He was getting... No, sorry. They came in from their dentist office where he was getting his wisdom teeth taken out and went into cardiac arrest. Unfortunately, he passed away. I have many friends who need to get their wisdom teeth removed, and telling them this story is freaking them out. What are a list of good questions to ask when meeting with the dentist doing the surgery? Likewise, what would be acceptable answers? Well, you want to know what kind of anesthetic is being used. If they're using only local anesthetic, so any dentist is well qualified to use local anesthetic, right? They infiltrate the nerves of your mouth with local anesthetic. It numbs up your mouth, right? So if someone's using just local anesthetic, I guarantee that this person who died did not have local anesthetic. They were also given a sedative. Okay, so what you should ask is what kind of sedation are you using, and what kind of training has the dentist had to administer that sedative safely, and what kind of rescue do they have in house in their office to rescue someone's airway? Does that dentist have training to rescue their airway? Meaning, if they go apneic from the sedatives, are they qualified to help that patient breathe again? Because if I had to guess, this patient probably died from respiratory arrest. They probably became oversedated. It went undetected, and patient stopped breathing. They went apneic, and it went undetected while the patient died. And then they figured it out once the patient was blue. Probably that's probably what happened if I had to guess. So those are the questions to ask. What kind of anesthesia do you use? Now, what kind of anesthesia do they use in dentist office? I honestly get confused by this myself. All the different I'm no expert. I don't know a lot about dentistry, to be honest, right? So I don't know if I have if I can answer this question perfectly, but if they're using, so the medications that will sedate somebody that can cause this apnea, the medications that won't cause, when I had my wisdom teeth removed when I was like 19, the dentist used laughing gas and then local anesthetic. That's very safe. If they're using just laughing gas and local anesthetic, you're safe. Laughing gas does not cause apnea. You will not go into respiratory arrest. Like, that's just not going to happen with laughing gas. That, to me, is very safe. Very safe. But if you're using benzodiazepines, like midazolam, some also called Versed, or Ativan, or lorazepam, or diazepam, those can cause apnea, right? And then certainly if they're using any opiates as well. I don't know if dentists are allowed to use opiates. I don't know. Again, I don't know. It probably depends on state law. Like, this is a complex question that I don't know if I'm fully qualified to answer. But you need to ask what kind of anesthetic they're using. And then if they're using benzos, are they qualified to rescue an airway? Have they have that training? This letter writer goes on to say, I know that wisdom teeth removal generally goes good. It does. I just want to make sure that my friends will be in the best hands in case something goes wrong. I overheard the doctor running the code on the boy, and it sounded like the dentist gave too much sedative and did not start CPR when his heart stopped. Exactly what I said. They didn't start. They likely they got too much sedation. I don't know what the sedation was, and the apnea event went unrecognized. So another question is, what kind of equipment do they have to recognize apnea? The gold standard is you have to observe someone's end-tidal CO2. Are they blowing out CO2 with every breath? Every breath. Because that's how you know if someone's going apneic, is if they're no longer ventilating and they're no longer blowing out CO2. And do they have pulse oximetry? Are they monitoring your oxygen saturation of your hemoglobin? And are they monitoring your end-tidal carbon dioxide? Those are the questions to ask. And if they're not, that's how it went undetected, because they're not monitoring with these things. I'm hoping asking good questions will give us peace of mind that the surgeon has a safe anesthesia plan and knows what to do in case things go bad. So that's my answer. What kind of sedation are they using? If it's just local anesthetic and nitrous oxide or laughing gas, that you don't need monitor. That you don't need a person will not go apneic. It's very safe. if they're using more sedation like a benzodiazepine or opiates or propofol, oh my gosh, they got to have pulse oximetry. You got to have end-tidal CO2, and that person must be trained and qualified to rescue your airway. That's I think it's the best way I can answer that. All right, time to move on to some books, which is my personal motivation for doing this podcast. Is because I read so many books and I have to have an outlet. I have to spill my books on into your brains. Okay, I'm going to talk about 4 books, and I'm not kidding. But these 4 books are highly related. Okay, and I think if you join me for the next probably 20 minutes here, I think you're going to be happy with my discussion. I think you're going to be happy that you're going to hear about these books. Okay, I'm just going to jump right into it. All of these 4 books are related, and it's kind of like I did like a tour of a specific subject, right? So let me just start. Okay, the first book is a lot of these books have to do with the Spanish Civil War, and then George Orwell, who fought in the Spanish Civil War and how it influenced his 1984 An Animal Farm. Okay, are you ready to join me? So first book we're going to talk about is Spain in Our Hearts, Americans in the Spanish Civil War by Adam Hochschild. Now, if you've paid attention, this is like probably the fifth Adam Hochschild book I've mentioned on this podcast because he's amazing. I should probably stop reading the same historical writer. I mean, I read other historical writers, but he's really incredible. Seriously, he's amazing. I mean, he just has an absolute gift with engaging with the reader with human stories while also giving an accurate and what I believe is a fairly balanced account of historical events. So I lived in Spain for 2 years as a young man. Yet during my time there, I knew very little and understood even less about the Spanish Civil War and its consequences. Franco was always spoken of in Spain when I was there with hushed and hurried words. It was as if the 30-plus rule of a fascist dictator over the country never really happened or just never really talked about. This book, Spain in Our Hearts, will tell you the story of the sympathetic Americans who, on their own accord, went to Spain to fight a fascist movement and the tragedy that happened while the Western world chose, basically, who would be the victor by their inaction. This war was fought between the leftist Spanish Republicans and the nationalists, who were controlled by Francisco Franco. The Republicans were a leftist coalition of communists, socialists, separatists, and straight-up just anarchists. But this war was not only a war like a right-wing fascist attempt at a coup, but also an anarchist revolution, much different from the Bolshevik revolution in Russia. During this civil war, an anarchist revolution of probably the most historical significance occurred in Barcelona, Valencia, and Catalonia. There were regions during this time that literally abolished money, like in Barcelona, and implemented worker-owned production. It didn't happen very long. I think it was only a few months, but it did happen. There was no money. There was no class. There was no tipping. Is very interesting. The Republicans also were joined by Ernest Hemingway and George Orwell, the writers, and they fought in their cause. Orwell was even shot in the neck and almost died. Much of their work, including Orwell's 1984, which I'm going to talk about, which I reread recently, was influenced by their time in Spain. Let me quote George Orwell to you. He said, "Every line of serious work that I've written since 1936 has been written directly or indirectly against totalitarianism and for democratic socialism." But reading this book, you understand that the cards were stacked against the leftist Republicans from the beginning. The other fascists during this time, Mussolini and Hitler, they supported Franco. Hitler saw Spain as a fertile war experimenting for when he would try to take over Eastern Europe and wage a war against France and UK in the 1940s. Right from the get-go, Franco was well supplied with arms and supplies from Italy and Germany as well. The only state supporter of the Republicans were Stalin. That's the only government that supported the leftist Republicans was Stalin and the communists. And they gave them basically a bunch of old crappy guns. Aside from the Russians, the Republicans were joined by a bunch of international brigades, around 35,000 people, that joined because they sincerely believed in their leftist cause and they loathed fascism. There were war crimes and atrocities on both sides, of course, as all wars go. The Republicans cannibalized themselves with tons of infighting amongst the Communist Party and the anarchists, which is like so classic. This is what leftists do. They cannibalize their own movements. Happens over and over and over again. It's happening in the United States right now. Happens everywhere. Things got bad with the leftist factions in Barcelona in May of 1937 when they fought one another in basically a civil war within a civil war after the Communist Party and its Catalan branch tried to take over an anarchist-controlled exchange. The Republicans had tons of gold left over from selling stuff during World War I because they were the government of Spain during World War I, but they had no one to buy from except for Russia. So what was the U.S. doing during this? Number one, they were just chilling out. FDR and the U.S. had an embargo on selling arms to any regime at war, apparently. So the U.S. officially sat things out of the Spanish Civil War, putting up their feet to see how the whole fascist coup would pan out. But who was involved? Texaco, the company Texaco. They gave all the gasoline to Franco that he needed on credit. Also, Franco's army had around 12,000 trucks from General Motors and Ford. So officially, the U.S. wasn't involved, but unofficially, the U.S.-owned corporations absolutely ensured Franco's victory. So not only did the U.S. not pursue a proxy war against Hitler and Mussolini, which that's what it would have been if they had supported the Republicans, but the U.S. decidedly and knowingly and by de facto supported a fascist movement. One cannot help but speculate about if the U.S. had actually aided the Republicans over Franco. What would the impact have been for World War II later? Perhaps Hitler wouldn't have felt so emboldened after Franco's victory, and also having practiced his own war games over the innocent civilians of Spain. Of course, I'm speculating, but it's reasonable to assume that allowing fascist regimes to run roughshod over the entire Spanish population certainly didn't deter them from their ambitions. So that's Spain in Our Hearts by Adam Hochschild. Okay, after I read this, I immediately read Homage to Catalonia by George Orwell, which is his memoir from fighting in the Spanish Civil War. So let's talk about that. We get his first-hand account of his time fighting with the anarchist militia called the POUM, and against the fascist Franco trying to usurp the Spanish Republican government. This book by George Orwell was highly readable, highly pertinent to what is going on in Spain at the time. Orwell and his wife spent their time in Barcelona, where they experienced a whiff of that anarchist society that I talked about. There was no class distinction, no tipping, no money. Of course, this only lasted a few months, as the Communist Party, who had major influence there, didn't like workers controlling anything very much, which is extremely ironic. But that's how the Soviet Communist Party really went, right? It wasn't really a workers' movement. Anyway, Orwell spent a lot of time being very bored and very uncomfortable, waiting around for action. He threw some grenades and fired some shots at the fascists in the south, but he didn't see much action for quite a while. We get a lot of his observations about the Spaniards and the ridiculous political divisions amongst the Republicans. Orwell was there to fight fascism. That's all he cared about. The huge alphabet soup of all the different leftist parties was an enormous distraction, and the infighting was tremendously counterproductive. Orwell didn't care what party he belonged to or fought to. He just happened to be fighting with the POUM, the anarchist militia, but he was kind of aloof and disgusted by the political divisions. He hated Franco and Hitler, and he wanted to stop them. That was his main thing. But there was an enormous sense of futility and inevitability in his account here. Quite presciently, he knew that some form of fascism would take over in Spain, either from the communists, who controlled much of the Republicans, or from Franco. But he figured Franco was by far the worst option. I loved his sentimentality he has towards the Spanish people in this book, and believes that a milder form of fascism would come than in Germany, simply because of the sensibilities of the Spanish people. I thought it was kind of touching. The really aggravating thing in these pages of this book was the inaccurate reporting, the lies, and the party propaganda that happened around the Spanish Civil War that Orwell talks about. It's amazing to hear what he says newspapers are saying as opposed to his very first-hand account. He was in Barcelona when the leftist infighting began, and the Communist Party attempted to purge and criminalize the anarchist POUM party and cast the party as fascist spies or Trotskyists. None of it was true, but the purge happened anyway. The truth was the Communist Party didn't want workers and anarchism happening as much as Franco didn't, and so they wiped them from the political landscape. The Communist Party and the Soviets were clearly as authoritarian and totalitarian as any other form of fascism. The fact is apparent in this memoir, as well as Orwell's 1984, which I'm going to talk about. One cannot help to think that the overt propaganda and believing lies likely informed his work in 1984. Of course it did. Orwell did see some action. Like I mentioned before, he was shot in the neck, and he lost the use of his hand and his voice for a bit. He was lucky he recovered, and so it's amazing that we hear his story. You'll get to know Orwell and his what sounds like a wonderful wife in this book, and come to understand the humanity and decency behind simply wanting the best thing for most people. This memoir will remind you that politics is garbage and that it doesn't change. Everything in this book and what happened in Spain in the Spanish Civil War is relevant to today. So that's Homage to Catalonia by George Orwell. All right, now let's move on to 1984. So for me, this was a reread. I just reread it recently. And the first time I read it was a long time ago when I was in junior high. That was the last time I read it. And I enjoyed the book then, but it's only reading it now that I understand the significance of the book. George Orwell provided not only a landmark framework for a totalitarian society, but a well-written story with a character full of dimensions. The prose is in the imagery and the emotion, it makes your heart break for the main character, Winston Smith. But as mentioned before, I think Orwell's own experience fighting with the anarchist political party, the POUM, and his opinion of the Soviet Communist Party there, as well as his disdain for Franco and the fascists, obviously influenced his work in 1984. I want to repeat the quote that I mentioned earlier. This is from George Orwell. Every line of serious work that I have written since 1936 has been written directly or indirectly against totalitarianism and for democratic socialism. What Orwell has provided in 1984 is a mental framework about how totalitarianism can operate, from controlling the past, state surveillance, fabricating false dissent, a centrally controlled economy, destruction of productivity surplus, abolition of language, partition of classes, and the extinction of independent thought. In my opinion, it's one of the greatest literary gifts in history, this book. So it's a tragedy from start to finish, from page 1 to the last page. Okay, the specific tragedy is the triumph of the state over the human soul. The story of Winston seems like a roller coaster story arc, but by the end you understand that every bit of it was a fabrication of a totalitarian state, every bit of his life. The isolation of Winston and his inner and secret observations about the party, his rebellious acts of writing in his diary and buying trinkets that were illegal and reliving his trauma from his childhood and his political act of romance with Julia, every drop of it was observed and even provided by the Big Brother party. The reader believes that Winston is still in control of his mind and his will and his emotions and his devotions. You are with Winston, and as he is with Julia, and they rebel with their romance and their secret hiding spots, you're there. But there's foreshadowing all over the place. Right, here's a quote. He was a lonely ghost uttering a truth that nobody would ever hear. Except he wasn't a lonely ghost. He was an unwitting agent of the thought police, undergoing their re-education. His rebellion was part of his re-education. His entire dissent was fabricated by the thought police. The illegal book written by a dissenter was in fact written by Big Brother. And that's what makes this book such a tragedy, is the entire life of Winston Smith is in complete and utter control of the state. It isn't until the very end of the book that they finally capture his mind, but it took building up his own ego, rebellion, indulgence in the things of life that actually make one happy, and then to force him to betray them and then burn it out again. What's left is a husk of a human mind and quote-unquote love for Big Brother. The framework and playbook that Orwell provides about how a complete totalitarian state can operate is a work of prescient genius. Is this book critiquing the Soviets? Of course it is. But it's way more than that. Orwell was clearly no fan of the Communist Party. But this book shouldn't be interpreted as communism, socialism equals totalitarianism. I mean, it historically it kind of does. But Orwell identified as a socialist. Here's a great quote from the book. I think that describes a lot of it. This is from 1984. The party rejects and vilifies every principle for which the socialist movement originally stood, and it chooses to do so in the name of socialism. It systematically undermines the solidarity of the family, and it calls its leaders by a name which is a direct appeal to the sentiment of family loyalty. Right? That's from 1984. That's clearly describes the Communist Party, the Soviet. Orwell very clearly shows that it was by co-opting popular movements that the Big Brother party came into control, the exact same way the Bolsheviks did. 1984 gives us the extreme dystopian version of total state control. Here's a couple other great quotes. Power is not a means, it is an end. One does not establish a dictatorship in order to safeguard a revolution. One makes the revolution in order to establish the dictatorship. And how did Big Brother go beyond all the communist and fascist attempts at totalitarianism? Here's the answer. This is another quote from the book. I love this. The aim of the high, like the high class, is to remain where they are. The aim of the middle, or the middle class, is to change places with the high. The aim of the low, or like the proletariat, when they have an aim, for it is an abiding characteristic of the low that they are too much crushed by drudgery to be more than intermittently conscious of anything outside their daily lives, is to abolish all distinctions and create a society in which all men shall be equal. So basically what I learned from this is what an aristocracy does, or a dictatorship. They allow the middle and upper class rivalry. What I mean is there's clearly in this book, there's clearly is a system in place for the outer party or the upper middle class to compete with the inner party or the aristocracy. And they can do it in this book, they do it across racial and descendant lines, meaning the constant rivalry between these two groups ensures that the middle class will never harness the power of the proletariats. The other level the state uses is fabricating dissenters and then burning the rebellion out of them through physical and mental torture. That ensures fealty to the party in the upper class. The other important angle is to be at constant war to dump the economical surplus so that there isn't anything close to equity along the class lines, ensuring well-demarcated divisions. The fact that Orwell lays out all this framework told over an incredible character with beautiful prose, it's an amazing literary achievement. If you haven't read it, you should read it. If you haven't read it in a long time, you should reread it. Okay, fourth and last book I'm going to talk about. I also read Animal Farm too, which I was about to talk about that, but I'll let it go at that. But I am going to talk about this book called My Further Disillusionment in Russia by Emma Goldman. This was written in 1923. Okay, so let me, if you've listened to my podcast, you know that I'm a person that's read, plenty of communist sympathetic texts as well as Western society critiques, right? And I enjoy reading stuff like that. I enjoy Marxist critiques of capitalism, and I generally endorse social democratic policies, right? I'm not a socialist, I'm not a communist, but I think social democratic policies that are put in place by Western democracies, generally a good idea. But I'm generally horrified by the history of the Soviet communist regime. And sometimes my mind is utterly blown away when I'm gaslit by modern-day communists, when I criticize Soviet Russia, and I'm belittled into believing that I'm simply an indoctrinated Western propagandist. Okay? That's why this book was so amazing for me to read. Is there anyone more apt to critique and provide an unbiased opinion of Soviet Russia and the Bolshevik Revolution than a leftist anarchist who was imprisoned and then deported from the U.S. for being too radical in 1921? That's who Emma Goldman was. Okay, in this book, there's no, quote, Western revisionist history. Anarchist Emma Goldman simply gives her unadulterated opinion of the Bolshevik movement because she went there in 1921. So what did she find? That it was bad. Okay, it was bad. Emma Goldman was hoping for like an anarchist promised land when she came to Russia, but she only found state-inflicted famines, political prisoners, rationing of food, tiered salary from the state, arrests of writers and dissenting opinions, state capitalism, and an overall oppressive authoritarian regime. Sounds like everything else I've ever read about the USSR that is allegedly, quote, Western propaganda. All the Bolshevik Revolution did was according to Emma Goldman, was a scene change from the Romanovs sitting on a throne to Lenin sitting on a throne. That's a quote from Emma Goldman from 1921. Okay, that's a quote from a leftist anarchist visiting Russia in 1921. She asserts that Lenin was a politician, contorting his rhetoric and actions to stay in power just like any other politician before and after. The Bolsheviks bastardized the concept of revolution. Goldman's observations in the afterwards of this book are really brilliant. She's a fiercely intelligent thinker. She was also a terrorist who plotted the assassination of Henry Clay Frick, so she's no paragon of virtue. I'm not saying that she is. Certainly not. But Goldman argues that the peasant class revolution that happened in Russia actually subverted Marxist ideas. Marx argued that a society needed a sufficient degree of industrialization to then move to a socialist revolution. Goldman states that the largely agrarian people of Russia didn't even know about Marx's theory and went ahead and started a revolution anyway, totally upending that theory. It was then the Bolsheviks and the Lenin cadre that co-opted the movement and rebranded their own authoritarianism. That's Emma Goldman's words, not mine. Reading this book was an exercise in confirmation bias for me, I will admit that, and it honestly felt very good. I will not let another modern-day communist lead me to believe that Soviets were building communism and how wonderful they were because they gave free education and healthcare to people. I got news for people like that. Other modern Western societies have done that exact same thing without overt authoritarianism and overt civil rights violations. I'm sure you're sick of hearing about it, but I'm sick and tired of the Soviet apologetics. It's unfathomably insulting to the victims of that terrible, terrible regime. Anyway, I think I'll be done talking about this topic for a while. You're probably sick of it because I think I mentioned it in my last podcast, but obviously it's something that's been on my mind. I do like to try to understand the Soviet movement, and it's a difficult thing to understand because you got a lot of historical revisionists and you have a lot of, you do have Western propaganda, right? Anti-communist propaganda that you need to understand. Anyway, there you go. There's the books for today. They're all related. I really enjoyed reading all these 4 books like right in a row. It really, I really enjoyed it. Anyway, that's it for today. Thanks for listening. ICU Doc Talk. Leave a review if you have not. Help the podcast grow. You can email me at icudrecmo@gmail.com. And I'll see you next time. Thanks.